One of the most popular beverages in the world is coffee. Whether tea ranks above it or not, I have to check the statistics, but those are the two popular beverages, and both of them are stimulating beverages. And I have to believe that's the reason people consume them, is they like to feel better. A little high is what they describe it as. And so that's one of the reasons of the popularity of both tea and coffee. I'm going to separate the two now and just talk about coffee. Coffee being a positive, tasty, stimulating beverage also has some adverse effects associated with it. You don't go stimulating the body without having some positive and negative effects. You may feel more awake, more alert, keener, etc. That you like, but you don't like the fact that you can't sleep. You have insomnia now, or you are jittery. You can't hold a pointer without shaking. So there's a toxic side, an adverse effect side of consuming this particular drug. Coffee does some very interesting things to the body. If you consume regular coffee, percolated, it raises blood cholesterol. But if you put coffee through a paper filter, in other words, a different brewing method, as opposed to, say, the basket, which you percolate coffee through, say you put it through a paper filter, what happens is it removes a couple of fatty acids that raise blood cholesterol. So coffee doesn't always raise cholesterol. It's only if you don't put it through a paper filter that raises cholesterol. Coffee raises blood pressure, so does tea. When it comes to tea, the blood pressure becomes pretty normal pretty fast, and it's associated with a lower risk of dying of heart disease than is coffee. But the concern is because the elevation of blood pressure, the elevation of cholesterol, that coffee could lead to heart disease. I don't think that's what the literature really does say, if you look at the bulk of the science. But again, that could be because people like to hear good news about their bad habits, and I admit to you as a form of disclaimer that coffee has been, at times, one of my preferred beverages. So I like the studies that come out that say that you have a reduced risk of heart disease if you drink coffee, or cancers, or other kinds of problems. You live longer. And there's research, good research, that says all these things. So, you're better able to tolerate some of the adverse effects. Coffee drinkers know where every bathroom is in town because they're always urinating because of the stimulus of the bladder of coffee. They pretty much know where every bathroom is in town also because it stimulates defecation. Coffee drinkers are notorious for suffering heartburn, indigestion, gastroesophageal reflux disease, GERD, sour stomach, that kind of thing. This is caused by the alkaloids that are present in coffee, not by the caffeine. That's important to understand. You can take the caffeine out of coffee and make decaf, and you still get as much intestinal distress acid production as you do with regular coffee. It's not the caffeine. It's other alkaloids that cause the indigestion and the rise in, there are other substances that cause the rise in cholesterol. But anyway, if you have a problem with indigestion, you want to give up both the regular coffee and the decaf coffee. So there's a couple of problems. The other thing, there's been some research in the past that suggests that fibrocystic breast disease is due to coffee. I don't think that's true. I don't think the research has bared that out. So I think you have to deal with the stimulation, the rise in some physical parameters that aren't associated with better health, like cholesterol and blood pressure, when you're dealing with coffee. And it's addictive. That's one thing I want to mention is we used to run a really pure program where at St. Lita Hospital, we of course never served coffee because they were an Adventist hospital, even though, by the way, their doctors and the nurses at St. Lita Hospital drink coffee, but never to our patients when we serve coffee. It's against their religion. And when we first ran our program at a resort, for the first couple of years, we took all the coffee pots out of the room and didn't serve any coffee at all. And what we found is it ruined people's time at the program. They had terrible headaches, horrible depression. There are people who couldn't leave their room for a couple of days because they were suffering so much from caffeine coffee withdrawal. So we don't do that anymore. We make sure people know where to get their caffeine fix when they come to the program. We don't need to deal with drug addiction at the same time we're dealing with food problems. I think I would encourage anybody that's not having coffee as a bad habit to not start it. But those of you who have it as a quote bad enjoyable habit, look forward to it. I think it's been oversold as far as a detriment to your health goes, even though it has some significant adverse effects.